Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. Miss Purple, the right mind for any time. My name is Deborah Ann Sanders. Nickname is AKA Miss Purple. I have 30 years of psychiatric experience, especially in the mental health department of nursing. I was born in Akron, Alabama, raised in Birmingham, Alabama. I started my nursing career as a candy striper, a nurse attendant, a LVN, an RN, BSN RN, and 2 years of graduate school. I have worked in several facilities in Los Angeles for the federal government, the county, private sector, and now I work in the Psychiatric Behavior Medicine Unit at White Memorial Medical Center under the director of Dr. Michael Hernandez. And we have several other unique staff that work at the Behavior Medical Center. The subject that I'm planning on to expound on is things that occur when a person is in the hospital, inpatient facility. Not every individual who struggle with mental illness end up in the hospital or suicidal. When the psych or mental illness get urgent or severe enough, the symptom, it requires a higher level of care. And at that point, the person is usually admitted into a psychiatric hospital and can be a very meaningful experience to stabilize your mind. The inpatient hospital used to have a stigma against it in the past. When people said mental illness hospital, they look at what they call a rubber jacket, a mental health bed where they boil people down to the bed, give people all kind of medication, and a wicked nurse come around and give you a shot. Inpatient hospitalization have came a long way. We do not use those type of punishments to treat a person with mental illness. To further expound on inpatient treatment setting, the inpatient service are often designed within the hospital itself. It may be separated like OBGYN, and then you got mental health. It's on a wing by itself. The colleague they usually work on in the hospital unit is usually individual therapy room. They also have an OT room and also have clinician. When you're in a severe crisis mental health team, sometimes your therapist may call ahead and ask the hospital, do they have a bed for him or her client because they feel like she's suicidal. At that time, the clinician may or may not put you on a hold, but they may do a referral to a hospital that accepted mental illness so that they can give the information on the phone and your transition into a mental health hospital can be at a more rapid pace. There are several professional teams that make up inpatient hospitalization. You're looking at your psychiatrist, your psychologist, your social worker, your music therapy, recreation therapy, and also your art therapy. Also, the nurses included in part of that team. It's a complex and a whole psycho-collaborative team which is working for the benefit of the client once they get to the hospital. If you're a child or a teenager, that hospital also to provide you with teacher so you won't get behind in your study when you return back to the academic world. Once there, you'll be evaluated from admission by the unit crisis team and assigned to a clinician or a caseworker. You may get your blood drawn. Not only get your blood drawn, you may also give us some urine specimen when you come into the hospital so we can see what kind of chemical you have in your body. Whether there's something in your body that can cause your behavior change, for example, meth, alcohol, cocaine, or whatever. These are things can influence your behavior. And doing the labs and the blood work, it gives the doctors and the nurse that taking care of you some kind of guideline on which way to treat you. Also, it may discover that you may have hypothyroidism during the exam, which that can either affect people's mental status. There's also a lot of rules and regulations. You can have access to your clothes while you're an inpatient, but you cannot have any clothes that have a string onto it because it may potentially cause you to commit suicide. Also, according to the state, most people are not able to have food brought in from the outside because we don't know what's inside the food, and we don't know that the food may be growing bacteria. If the inpatient stay is planned, you can pack a bag of comfortable clothing while you're in the hospital. Not a whole lot of clothing because you only just got a small locker to hold certain things. Anything with belt, strings, and shoelace, they're not initially given to the patient due to the fact the patient can use this to harm themselves. While you're in the hospital, bring a list of your medication. Say, for instance, you came to White Memorial and next time you at USC. So keep a continuity of your medication. Bring a list of your medication when you're admitted to the hospital. So you can show the professional people and they can write it down and put it in the computer under your home med. Once you're admitted to the hospital, you may find a treatment center follow a daily routine, meals, clothes, individual or group counseling during the time you're in there. Even though you may be having complications with your family, sometimes the family is coming along during the treatment process where you're inpatient and see what the hospital or the clinician can do to help you to return back home if your family would take you back home. When you enter into the hospital, at that particular time, your discharge plan is already began to set up. The process of discharging plan prepare you to leave the hospital. It should begin on the day you initially admitted to the hospital. At least several days before the plan, you have your discharge plan. And what is some type of discharge from the hospital? It could be a supervisor discharge. It could be a deferred discharge. It could be a summary of a different type of discharge. It can be a full or unrestricted discharge, or discharge that restricted a patient. What are the steps of the discharging process? The processes of the discharge planning include the following: early identification and assessment of the patient required that need assistance with planning from discharge. Collaborate with another team member such as your doctor, your nurse, your social worker, the counselor, physical therapy, recreation therapy, and movement therapy. They may become part of your discharging plan. Discharge plan is a team approach. It should include the client also along with the family if the client chose to have the family to come and sit in on his discharge plan. During the treatment plan team include the psychologist, the social worker, psychiatrist, case manager, vocational specialist, housing, and profession who should participate in creating a smooth discharge plan. In addition, the team should include the community partner of the client, such as a peer, relative, and also maybe a friend. As the discharge plan proceed on, there are specific discharge dates and time that a patient have to stay or leave the hospital. Emergency readmission is pressure on the hospital because the hospital, when they discharge you, they want to make sure that you don't come back on emergency readmission. It should always begin in the form the day the person entered into the hospital, they will be working on their discharge plan and become a patient in the hospital bed. What happens when you get discharged? There are several things happen when you get discharged. The discharged patient are given a written plan that include where they are going to get their resource, whether housing, whether medication, whether outpatient. They should get all that on discharge. The crisis number in case they be in a crisis and need to come back to the hospital. Discharged patients are also given a supply of medication. Usually they're given a 30-day supply of medication. The type of discharge is supervisor discharge, deferred discharge, summary of type of discharge, full discharge of unrestricted patient, deferred discharge of unrestricted patient. Thank you for listening to my podcast on The Right Mind for Any Time, and I'll see you next time.